The board members that are involved in this organization are individuals that are tremendously committed to making a change and a difference. These are individuals that are friends of the Donatucci family, friends of Michael Donatucci, friends of Ron Donatucci, but it goes much further than the personal friendship to contribute to a solution for these folks. And so our board is a board that is kind of like the Philly Special or the Philadelphia Eagles, right? It's everybody working together as a team for 34 seconds, time and time again. Not to score a touchdown in football, but to score a touchdown to help kids and young adults in Philadelphia and around the country survive this awful disease. Our mission is really to help as many young individuals as we possibly can who suffer from depression and anxiety.
We're doing it 4 ways: through education and our high school outreach program, and with the partnership of Temple University Health System, specifically Dr. Dubin, who's the head of the psychiatry department, and his residents. We are able to go to high schools in the surrounding area and within Philadelphia, charter schools, public schools, private schools, parochial schools, to be able to get the word out about anxiety, depression, bullying, and substance abuse, so that once again we can raise the level of awareness, help the children as well as the educators and the parents understand what the symptoms are, and then know what to do about it.
One of the things that we tried to do in collaboration with Michael's Giving Hand is we would pilot a program here at St. Joseph's Prep to help our students become aware of the issues that some of their classmates are facing, and just raise awareness about adolescent mental health. We've also worked very closely with our incoming 9th grade parents over the last 2 years, and it's been to great effect.
Which leads us into the second path that we take, navigating. We navigate the information that's out there so that you don't have to try to figure it out on your own. We want you to recognize and understand that you are never alone. Every single step that you take on this journey, we are here to support you. So by helping you to navigate the resources available, we are also able to provide and complete from knowledge to treatment path for you and your family, and specifically your child. So with the partnership of Jefferson Health System and specifically Dr. Vergara and the Department of Psychiatry, we're able to provide our adolescent mental health counseling program, which allows for a teen to come in, be assessed, and then have a diagnosis as well as a treatment plan so that they can feel better. They can move toward better health for not only the short term, but their long term.
Well, Michael's Giving Hand has been a welcome addition to the Philadelphia scene, and hopefully this will become part of the national scene. And what it's based on is a recognition as to how difficult it is for teenagers, young adults, and their families to find help when they're struggling with changes in personality, changes in mood, and in its worst form, suicidal thinking and self-destructive behavior. So that the focus of Michael's Hand is to reach out and then follow through. And that's really important in our field. It's relatively straightforward to make a diagnosis. But once you recommend treatment, a treatment that involves not just one individual, but the other important people in their lives, finding that care and being able to continue with that care can be difficult logistically in identifying places to go, and also financially.
Then there's the third path, advocacy. It's not enough for us to just do it for ourselves and for our fellow Philadelphians and those in the surrounding area. Advocacy means mental health professionals, means parents, educators, the schools. It also means activists, citizens who really are touched by this mission, who probably have their own personal story, to come and volunteer and help us not only spread awareness, but also to ensure that our government, that our healthcare system provides equal access to all who suffer from these illnesses.
Michael's Giving Hand is providing us with really high-end, qualified, more than qualified speakers for our students, for our parents, and for our faculty. So they're taking care of that entire sphere of people who are interacting daily with our adolescents. The organization of Michael's Giving Hand is also willing to provide treatment and to help a kid actually get better where the rubber meets the road, which is treatment, medication, hospitalization at times, right? And diving into that area of psychology is what will save lives.
And then our fourth and final path, which is the most critical path, is to erase the stigma associated with these illnesses. Anxiety and depression are not weaknesses, they are illnesses. And once we start to really chip away at the stigma associated with that, more people will talk about it, more people will seek care, more people will allow the treatment to serve them so that they can live a healthier life.
It can be difficult for a parent to accept that they need to be aware of this and be an advocate for their son or daughter, or that their son or daughter might have a challenge in this regard. So I think the very first thing that we work on is with the parents is to kind of destigmatize this. This is not the end of the world. Far from it. This is an opportunity for you to really go in and embrace your son or daughter and really help them and advocate for them and support them in a way that you might not have expected. But if you do that, they will be very, very grateful to you afterwards. So, and we want to kind of break through that, just break through that wall, destigmatize, and get our parents in a position where they can talk about this in a relaxed fashion, so that they can really, really become advocates for their sons and daughters.